This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Testoki 40mg tablet is used to treat testosterone deficiency in men. It helps improve various symptoms associated with low testosterone levels. Indications and uses. This medication is indicated for the management of male hypogonadism and osteoporosis. Male hypogonadism can lead to symptoms like decreased sex drive, impotence, infertility, and mood fluctuations, while osteoporosis can result in weakened bones due to insufficient testosterone. The treatment aims to restore normal testosterone levels, thereby alleviating these symptoms and improving the overall well-being of affected individuals. How it works. It works by replacing the deficient testosterone levels in men, helping to restore normal physiological functions. Directions for use. Take this medication as prescribed by your healthcare provider. It should be swallowed whole with a glass of water and taken with food to enhance absorption. Do not crush or chew the tablet. Your doctor will determine the appropriate dosage and treatment duration based on your specific needs and health conditions. Do not discontinue use without consulting your doctor, as this may lead to a recurrence of symptoms. Possible side effects. Common side effects include weight gain. In rare cases, serious side effects like liver problems or symptoms of heart attack may occur, necessitating immediate medical attention. Precautions and warnings. This medication is not suitable for individuals with known prostate or breast cancer, severe kidney disease, or heart conditions. Caution is advised for those with a history of heart attack, high blood pressure, or lung disease. It should not be used by pregnant or breastfeeding women, and its safety in children and adolescents has not been established. FAQs. 1. Can I take this medication for sexual dysfunction? No, it is not prescribed for that purpose. 2. Does this drug cause dependence? Yes, misuse can lead to dependency and withdrawal symptoms. 3. Can it affect my bones? Yes, it can cause rapid bone maturation, particularly in adolescence. 4. Should it be taken on an empty stomach? No, it should be taken with food for optimal absorption. 5. What if I forget a dose? Take it as soon as you remember, but skip it if it's almost time for the next dose. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below.